Question 1. A patient is prescribed sertraline for major depressive disorder. To which drug class does this medication belong? A. Benzodiazepine. B. Tricyclic antidepressant, TCA. C. Selective serotonin reuptake inhibitor, SSRI. D. Monoamine oxidase inhibitor, MAOI. Answer: C. Selective serotonin reuptake inhibitor, SSRI. This question tests your knowledge of common antidepressant classifications. Sertraline is one of the most frequently prescribed medications for depression and anxiety, and it functions as a selective serotonin reuptake inhibitor, a class that works by increasing the levels of serotonin in the brain. Other common SSRIs include fluoxetine and escitalopram, which are also used for similar conditions. A great way to remember this is to associate the S in sertraline with SSRI. Question 2. A patient with type 2 diabetes is prescribed metformin. What is the primary therapeutic classification of this drug? A. Sulfonylurea. B. Biguanide. C. DPP-4 inhibitor. D. Insulin. Answer: B. Biguanide. The question asks for the therapeutic class of metformin, a cornerstone medication for type 2 diabetes. The key clue is the drug name metformin, which is the only drug in the biguanide class widely used in the United States. This medication primarily works by decreasing the amount of glucose, sugar, produced by the liver and improving the body's sensitivity to insulin. Unlike insulin, which is injected, metformin is an oral medication that helps the body manage its own blood sugar levels more effectively. Remember, metformin is the go-to first-line oral anti-diabetic and it stands in its own unique class, the biguanides. Question 3. Albuterol is a common medication used in inhalers. What is its main therapeutic purpose? A. To reduce inflammation in the airways. B. To open up the airways during an asthma attack. C. To thin mucus in the lungs. D. To prevent allergic reactions. Answer: B. To open up the airways during an asthma attack. This question focuses on the function of albuterol, a widely used rescue medication. Albuterol belongs to a class of drugs called short-acting beta agonists, often referred to as bronchodilators, which work by relaxing the muscles around the airways. This action quickly opens the bronchi and bronchioles, providing relief from bronchospasm, which is the tightening of airways seen in asthma and COPD. Think of albuterol as a rescue inhaler used for immediate relief of breathing difficulty, not for long-term prevention. Question 4. A patient taking warfarin must have their blood levels monitored regularly to prevent complications. To which drug class does warfarin belong? A. Antiplatelet. B. Anticoagulant. C. Thrombolytic. D. Hemostatic agent. Answer: B. Anticoagulant. This question tests your understanding of medications that affect blood clotting, specifically identifying the class for warfarin. The key phrase "prevent complications" related to blood monitoring points towards a drug that thins the blood. Warfarin is an anticoagulant, a type of medication that slows down the body's process of making blood clots, and it is often prescribed to prevent strokes in patients with atrial fibrillation or to treat blood clots in the legs or lungs. A simple way to remember this is that anticoagulants like warfarin work against anti-coagulation, which is the process of clotting. Question 5. A patient is prescribed lisinopril for hypertension. This medication is a member of which drug class? A. Beta blocker. B. Calcium channel blocker. C. Angiotensin II receptor blocker, ARB. D. Angiotensin converting enzyme, ACE, inhibitor. Answer: D. Angiotensin converting enzyme, ACE, inhibitor. This question asks for the classification of lisinopril, a very common blood pressure medication. ACE inhibitors are a class of drugs that help relax veins and arteries to lower blood pressure by blocking the production of a substance that narrows blood vessels. These medications are used to treat high blood pressure and heart failure. A helpful tip for the exam is that most ACE inhibitor generic names end in pril, just like lisinopril, enalapril, and ramipril. Question 6. A patient is given a prescription for prednisone to treat a severe inflammatory condition. What is the therapeutic classification of prednisone? A. Nonsteroidal anti-inflammatory drug, NSAID. B. Corticosteroid. C. Opioid analgesic. D. Monoclonal antibody. Answer B. Corticosteroid. This question requires you to identify the drug class for prednisone, a powerful medication used for inflammation. The clue, severe inflammatory condition, suggests a potent anti-inflammatory agent is needed. Prednisone is a corticosteroid that mimics the effects of hormones your body produces naturally to suppress inflammation and the immune system, making it effective for conditions like severe asthma, allergic reactions, and autoimmune diseases like rheumatoid arthritis. Just remember that medications ending in -sone or -olone, like prednisone and methylprednisolone, are typically corticosteroids. Question 7. Alprazolam is frequently prescribed for anxiety and panic disorders. This drug belongs to which controlled substance class? A. SSRI. B. Benzodiazepine. C. Antipsychotic. D. Barbiturate. Answer B. Benzodiazepine. This question tests your ability to classify alprazolam, a common medication for anxiety. The drug is well known for its fast-acting calming effects, which is a hallmark of its class. Alprazolam is a benzodiazepine, a class of psychoactive drugs that work by enhancing the effect of a calming neurotransmitter in the brain called GABA. These are controlled substances due to their potential for dependence and abuse. A good trick for identifying this class is that many benzodiazepine generic names end in PAM or LAM, such as lorazepam, diazepam, and alprazolam. Question 8. A patient complains of seasonal allergies and is recommended to take loratadine. What is the therapeutic classification of this over-the-counter medication? A. Decongestant. B. Corticosteroid. C. Antihistamine. D. Leukotriene inhibitor. Answer C. Antihistamine. This question asks for the drug class of loratadine, a common remedy for allergies. The keyword seasonal allergies points directly to the primary use of this medication type. Loratadine is an antihistamine, which works by blocking the effects of histamine, a substance released by the body during an allergic reaction that causes symptoms like sneezing, itching, and a runny nose. Unlike older antihistamines like diphenhydramine, loratadine is known for being non-drowsy. Remember, if a drug is used for common allergy symptoms, it's very likely an antihistamine. Question 9. Atorvastatin is a widely prescribed medication for what primary purpose? A. To lower blood pressure. B. To lower high cholesterol. C. To control blood sugar. D. To prevent blood clots. Answer B. To lower high cholesterol. This question is about the primary use of atorvastatin, one of the most common medications in the world. Atorvastatin belongs to the HMG-CoA reductase inhibitor class, more commonly known as statins. These drugs work by blocking an enzyme in the liver that is necessary for producing cholesterol, thereby lowering levels of bad cholesterol, LDL, in the blood to reduce the risk of heart attack and stroke. A super helpful tip for the exam is to recognize that most drugs ending in statin, like atorvastatin, simvastatin, and rosuvastatin, are used to treat high cholesterol. Question 10. A patient with gastroesophageal reflux disease, GERD, is prescribed omeprazole. This drug belongs to which of the following classes? A. H2 blocker. B. Antacid. C. Proton pump inhibitor, PPI. D. Prokinetic agent. Answer: C. Proton pump inhibitor, PPI. This question asks for the classification of omeprazole, a medication for acid-related stomach issues. The condition mentioned, GERD, is a strong clue that the drug works by reducing stomach acid. Omeprazole is a proton pump inhibitor, PPI, which potently blocks the production of acid in the stomach, making it highly effective for treating GERD, heartburn, and stomach ulcers. For your exam, remember that the generic names for most PPIs end in the suffix prazole, such as omeprazole, lansoprazole, and pantoprazole. Question 11. What is the primary therapeutic classification of ibuprofen? A. Opioid analgesic. B. Acetaminophen. C. Nonsteroidal anti-inflammatory drug, NSAID. D. Salicylate. Answer: C. Nonsteroidal anti-inflammatory drug, NSAID. This question asks you to classify ibuprofen, a very common over-the-counter pain reliever. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID, that works by inhibiting enzymes called cyclooxygenase, COX, which reduces the production of prostaglandins, substances that cause pain, fever, and inflammation. This mechanism makes it effective for conditions like headaches, muscle aches, and arthritis. It's important not to confuse NSAIDs with acetaminophen, which reduces pain and fever but has very little anti-inflammatory effect. Question 12. Losartan is a medication primarily used to treat hypertension. To which class of antihypertensives does it belong? A. ACE inhibitor. B. Beta blocker. C. Angiotensin II receptor blocker, ARB. D. Calcium channel blocker. Answer: C. Angiotensin II receptor blocker, ARB. This question tests your knowledge of the different classes of blood pressure medications, specifically where losartan fits. Losartan is an angiotensin II receptor blocker, ARB, a class of drugs that works by blocking the action of angiotensin II, a chemical that narrows blood vessels. By preventing this narrowing, ARBs allow blood vessels to relax and widen, which helps lower blood pressure. A great way to identify ARBs on an exam is to look for generic names that end in sartan, like losartan, valsartan, and irbesartan. Question 13. A patient diagnosed with hypothyroidism is prescribed levothyroxine. What is the function of this medication? A. It suppresses an overactive thyroid gland. B. It replaces a missing thyroid hormone. C. It reduces inflammation of the thyroid. D. It blocks the production of thyroid-stimulating hormone. Answer: B. It replaces a missing thyroid hormone. The question asks about the purpose of levothyroxine, the primary treatment for hypothyroidism. The keyword hypothyroidism literally means an underactive thyroid, indicating the gland isn't producing enough hormones. Levothyroxine is a synthetic form of the thyroxine, T4, hormone, serving as a replacement therapy to restore normal hormone levels, which are crucial for regulating the body's energy and metabolism. So, think of levothyroxine as simply topping up the body with the thyroid hormone it's missing. Question 14. Amoxicillin is a frequently prescribed medication for various bacterial infections. What is its drug classification? A. Macrolide antibiotic. B. Penicillin antibiotic. C. Tetracycline antibiotic. D. Fluoroquinolone antibiotic. Answer: B. Penicillin antibiotic. This question requires you to classify amoxicillin, one of the most common antibiotics. Amoxicillin belongs to the penicillin class of antibiotics, which works by interfering with the bacteria's ability to build cell walls, causing them to break down and die. It is effective against a wide range of bacteria, making it a go-to choice for infections like strep throat, ear infections, and pneumonia. A helpful tip to remember this class is that many penicillin-type antibiotics have generic names ending in -cillin, such as amoxicillin, ampicillin, and piperacillin. Question 15. A patient with asthma is given a prescription for a fluticasone inhaler. To which drug class does fluticasone belong? A. Bronchodilator. B. Inhaled corticosteroid. C. Leukotriene modifier. D. Mast cell stabilizer. Answer B. Inhaled corticosteroid. This question asks for the classification of fluticasone when used in an inhaler. While albuterol is a rescue inhaler, fluticasone is used for long-term control. Fluticasone is an inhaled corticosteroid that works by reducing inflammation and swelling in the airways, making them less sensitive to asthma triggers over time. Unlike bronchodilators that provide immediate relief, corticosteroids are preventer medications used daily to prevent asthma attacks from happening in the first place. Remember, corticosteroids tackle inflammation, which is the root cause of persistent asthma symptoms. Question 16. Amlodipine is a medication commonly used to treat high blood pressure and angina. It belongs to which drug class? A. Beta blocker. B. Diuretic. C. ACE inhibitor. D. Calcium channel blocker. Answer D. Calcium channel blocker. This question tests your ability to classify amlodipine, a popular antihypertensive medication. Amlodipine is a calcium channel blocker, which works by preventing calcium from entering the cells of the heart and artery walls. This action causes the blood vessels to relax and widen, making it easier for the heart to pump and thereby lowering blood pressure. A simple way to remember some common drugs in this class is that many of their generic names end in dipine, such as amlodipine, nifedipine, and felodipine. Question 17. A patient is prescribed oseltamivir after being diagnosed with the flu. What is the therapeutic classification of this drug? A. Antibiotic. B. Antiviral. C. Antifungal. D. Antitussive. Answer B. Antiviral. The question asks you to identify the class of oseltamivir, which is specifically linked to treating the flu. The flu, or influenza, is caused by a virus, not bacteria or fungi. Therefore, oseltamivir is classified as an antiviral medication, which works by stopping the influenza virus from spreading inside the body. It is most effective when started within 48 hours of symptom onset and can help reduce the severity and duration of the illness. To keep it straight, remember that antivirals fight viruses, just as antibiotics fight bacteria. Question 18. Risperidone is a medication used to manage symptoms of schizophrenia and bipolar disorder. To which drug class does it belong? A. Antidepressant. B. Anxiolytic. C. Antipsychotic. D. Mood stabilizer. Answer C. Antipsychotic. This question asks for the classification of risperidone based on its use for conditions like schizophrenia. Risperidone is an atypical antipsychotic, a class of medication that works by altering the effects of certain chemicals in the brain, primarily dopamine and serotonin. This helps manage symptoms like hallucinations, delusions, and disordered thinking associated with psychotic disorders. While it can have mood-stabilizing effects, its primary classification is antipsychotic. An easy tip is to link drugs like risperidone and olanzapine to the treatment of psychosis. Question 19. A patient is prescribed hydrocodone/acetaminophen for severe pain after surgery. What is the primary drug class of the hydrocodone component? A. NSAID. B. Opioid analgesic. C. Benzodiazepine. D. Skeletal muscle relaxant. Answer: B. Opioid analgesic. This question asks for the classification of hydrocodone, a key ingredient in many strong pain relievers. The phrase severe pain is a major clue that a potent medication is needed. Hydrocodone is an opioid analgesic, a powerful class of pain-relieving drugs that work by binding to opioid receptors in the brain and spinal cord, blocking the perception of pain. These medications are a controlled substance due to their high potential for addiction and are reserved for managing severe pain that doesn't respond to other treatments. Question 20. Furosemide is a potent medication that increases urine output. It is primarily classified as which type of drug? A. Thiazide diuretic. B. Potassium-sparing diuretic. C. Loop diuretic. D. Osmotic diuretic. Answer: C. Loop diuretic. This question tests your knowledge of diuretics, focusing on the classification of furosemide. Furosemide is a loop diuretic, named because it works in a specific part of the kidney called the loop of Henle to prevent the reabsorption of sodium and water. This action causes a significant increase in urine production, which helps remove excess fluid from the body, making it very effective for treating edema, fluid retention, associated with heart failure, liver disease, or kidney disease. A helpful way to remember this is to associate furosemide's powerful effect with the loop it works on. Question 21. Gabapentin is prescribed for a patient with seizure disorders and neuropathic pain. What is its main drug classification? A. Antipsychotic. B. Anticonvulsant. C. Benzodiazepine. D. Opioid. Answer: B. Anticonvulsant. This question requires you to classify gabapentin based on its primary medical uses. While it's widely used for nerve pain, gabapentin was originally developed and is classified as an anticonvulsant, also known as an anti-epileptic drug. It works by decreasing abnormal excitement in the brain to prevent seizures and by altering how the body senses pain to treat nerve-related pain conditions like diabetic neuropathy or post-herpetic neuralgia. Remember that even if a drug has multiple uses, it has a primary classification, and for gabapentin, that's anticonvulsant. Question 22. A patient with a severe yeast infection is given a prescription for fluconazole. This medication belongs to which therapeutic class? A. Antiviral. B. Antibacterial. C. Antifungal. D. Antiprotozoal. Answer: C. Antifungal. This question asks for the drug class of fluconazole, with the key clue being its use for a yeast infection. Yeast infections are caused by a fungus, most commonly Candida albicans. Fluconazole is an antifungal medication that works by stopping the growth of fungi, making it highly effective for treating various fungal infections of the mouth, throat, and genitals. A simple way to remember this is that drugs with generic names ending in azole are very often antifungals, just like fluconazole, miconazole, and ketoconazole. Question 23. A patient with osteoporosis is prescribed alendronate. What is the therapeutic classification of this medication? A. Selective estrogen receptor modulator, SERM. B. Calcitonin. C. Bisphosphonate. D. Parathyroid hormone analog. Answer: C. Bisphosphonate. This question tests your knowledge of drugs used to treat osteoporosis, specifically alendronate. The keyword osteoporosis refers to a condition of weak and brittle bones. Alendronate is a bisphosphonate, a class of drugs that slows down bone loss by inhibiting cells that break down bone tissue, osteoclasts, which helps to increase bone density and reduce the risk of fractures. A great tip for the exam is that many common bisphosphonates have generic names that end in dronate, such as alendronate, risedronate, and ibandronate. Question 24. A patient is given a Z-Pak for a respiratory infection. The active ingredient is azithromycin, which belongs to which class of antibiotics? A. Penicillin. B. Tetracycline. C. Cephalosporin. D. Macrolide. Answer: D. Macrolide. This question asks for the classification of azithromycin, the drug found in the popular Z-Pak. Azithromycin is a macrolide antibiotic, a class of drugs that works by stopping bacteria from making the proteins they need to survive. It is often used for respiratory infections, sinus infections, and certain sexually transmitted infections. A helpful mnemonic is ACE, for the common macrolides, azithromycin, clarithromycin, and erythromycin. Question 25. A patient is taking metoprolol for high blood pressure. Which therapeutic class does this medication belong to? A. ACE inhibitor. B. Beta blocker. C. Calcium channel blocker. D. Angiotensin II receptor blocker, ARB. Answer: B. Beta blocker. This question asks you to classify metoprolol, a very common drug for cardiovascular conditions. Metoprolol is a beta blocker, a class of medication that works by blocking the effects of the hormone adrenaline, also known as epinephrine. This causes the heart to beat more slowly and with less force, which lowers blood pressure and helps manage conditions like angina and heart failure. A great tip for your exam is that the generic names of most beta blockers end in olol, like metoprolol, atenolol, and propranolol.